Hello, my name is Ahmad Yusuf and I am an internal medicine doctor here at Selene Health Systems and the director of the medical ICU. We wanted to make this video to give an opportunity to explain the new information you may be hearing about in regards to the two vaccines that are coming to market into the community for the COVID virus. I understand as a physician in the community and as a member of this community that there's a lot of hesitancy, a lot of anxiety, and a lot of fear revolving around the vaccines as they come to market. I want to first start off by saying that I totally empathize and understand why you may have those hesitancies and fears. There's a lot of information out there and a lot of misinformation as well. And those things combined can sometimes muddy the waters and make it really hard to make a good decision for you and your family. And I'm going to try my best in this short video to help you have that conversation with your family and make the decision for you and yourself and the people you love. I'll start with my own personal experience with the thought of the vaccine. 6 months ago, when we had not known much about what the processes were going to look like for vaccine research in the context of a ever-changing COVID environment and pandemic, I would have been equally as hesitant as many are out there in regards to taking a vaccine that was going to seem very new and innovative and perhaps rushed, which is a concern that people have. As time has passed, and I've spoken to many of the leaders in the infectious disease world and in the scientific community, it's becoming clear to me that despite the fact that this has been a quick process for FDA approval, it has not meant that it has been not a thorough process. And I feel more and more comfortable in that regard. A few weeks ago, I learned that my in-laws are going to move into town, which is really exciting for me and my wife and our children. My father-in-law, however, is of a high-risk category in regards to his risk for having a severe COVID infection. Given that, when I see the significant benefits in the scientific literature, and I weigh that against the risks for somebody that I so dearly love and care about, it has become a no-brainer for me and my family that I will get the vaccine. I want to not only worry about myself and my health, but also the people that I care about most in this world and the community members around me. And because of that, I will get the vaccine. It's important to note that certain subgroups will not be eligible for the first round of the vaccine, including those who are pregnant, have autoimmune diseases, or are immunocompromised. It'll be important as the vaccine becomes available that you feel comfortable enough to come to the physicians in Selene Health Systems or your primary care physician to ask any questions or concerns and go over the risk-benefit ratio for you and your family to protect yourself from this virus and protect our community as a whole. One of the most important values for me as you move forward as a community is that we have compassion in the way we deal with each other. Because this information is confusing, it is vast, it's unraveling and changing every day, I ask you, as your healthcare provider and as a member of our community, to find ways to be kind to those who have a different opinion than you. As information through the internet and social media and memes continue to badger us and make us sway one way or the other, I ask you to look for reliable sources of information via the healthcare providers who have spent their life and careers trying to help you make the best decision for you and your family in regards to your healthcare. That's what we want to offer you here at Selene Health Systems. And please feel free to reach out to us and let us know what we can do to help.